Mental health is a tricky thing to access, and a person's well-being often seems like a gray area.
But no one wants to live with the regret of wishing that they'd done something to help a person who is struggling. In today's Matters of the Mind series, Bree has a closer look at training designed to help you know when to step in. Hi, Bree.
Good morning, Catherine and Chris. How many times after something bad happens do we say, I wish I realized, or I wish I had known? It's impossible to know exactly what someone is thinking, but in mental health first aid, churches, schools, and everyday citizens are trying to pick up the subtle clues of a person in trouble.
Fire and ambulance.
When you're physically hurt, a 911 operator can talk you through first aid until medical help arrives. But when faced with someone having an emotional crisis, would you know what to do?
People are afraid. People don't know how to handle it. They don't know what they should do, or they're worried what that will mean.
Social worker Kathleen Bambrick is teaching mental health first aid to a full class of Norwell Public Schools faculty. Their superintendent, Michael Keegan, says the staff wanted to be proactive and have yet another tool to help them serve families.
Our ultimate goal is to have students learn, and we know that if you're struggling with social and emotional issues of any type, it can interfere with that process. And so it's just one more positive way in which we can really focus on our students and their well-being.
Becca, I'm concerned about you.
Through exercises like role-playing, the voluntary 8-hour training gives them signs to look for and a way to reach out to someone they're concerned about. Coordinated on a national level, the program can be tailored to adults or kids, and within the last 7 years has taught thousands about early intervention.
We walk them through how to assess, how to talk with somebody, how to approach somebody that they think is having a mental health issue. So they actually leave with a nice toolkit of how to handle those scenarios.
Kathleen says her job at South Shore Mental Health is getting busier as more groups recognize the need for emotional well-being.
I think the mental health first aid program does a great job of informing people and destigmatizing and demystifying what's happening with mental health problems and mental illness.
Mental health first aid is not about training psychologists or dispensing medication. It's a chance for everyday citizens to learn techniques for getting their loved ones help. And good news, South Shore Mental Health is offering a free class next Tuesday. For more info on that class and how to register for another class, you can check out cbsboston.com.